My name is Dr. Lisa Schilling, and I'm a pediatric psychologist at Nemours Children's Health Jacksonville, and I am the director of fellowship training for the postdoctoral fellowship in psychology. We have what I think is maybe the longest running fellowship program here at Nemours. We've had a fellow since 1994. I think that what makes this program unique is the comprehensive training opportunity. Often at the fellowship level, there is a tendency to be specialized in one primary area, and we have chosen to allow kind of that last opportunity for fellows under supervised training to pursue some additional interests and to see really what they're passionate about. We have 3 primary rotations, one of them being consultation liaison with Wolfson Children's Hospital, with whom we have a very close relationship, in which we provide inpatient services for general pediatrics and for many of the medical specialties, including hematology, oncology, endocrine, neurology, anesthesiology, and pain management. The second primary rotation is in oncology, and that involves working with inpatients from the time of their diagnosis and then following them outpatient throughout what is often many years of treatment. We also do a great deal of neurocognitive testing, so children with brain tumors or pre-transplant, pre-bone marrow transplant, or prior to radiation have a comprehensive evaluation of their abilities and their skills at that time, so we can then provide accommodations in the classroom, or we can go back later and see how they're progressing.
I would say that being a part of this program has helped me in my career goals by really allowing me to explore who I am as a psychologist, finding my own style. The culture as a fellow at Nemours really mirrors Nemours as a whole, and I would say that Nemours is very inclusive, very warm, welcoming. Everyone has welcomed me with open arms and just really made me feel a part of the team pretty much immediately.
Our last major rotation is in integrated pain and wellness, and that's supervised by Dr. Amanda Lockery, who is also our division chair.
Pediatric pain actually reaches across all sorts of different specialties and all sorts of different medical conditions. So to have this unique specialty training within a multidisciplinary setting where you're able to meet a lot of different types of families with a lot of different types of medical conditions, we have a very unique, I think, program here. The role of the pediatric psychologist is embedded in medical communities and medical hospitals, specialty clinics, and so it's really important for all of our fellows to gain expertise in working in multidisciplinary teams. So we have a pediatric anesthesiologist who is our pain doctor for this clinic, and then we also have a physical therapist from Brooks Rehabilitation. We are all able to meet as a team, and the patients are seen in our clinic all together. The other piece is just being able to work as a team and being a team member and being a valued member of that team and speaking up to other professionals that may be outside of your area of expertise is a really good skill to learn as you go out into the workforce.
I did not expect the amount of respect that the fellows get here. I feel like I'm respected as one of the physicians in the hospital.
We also have opportunities for a combined clinical and research position for fellows who might be interested in that, which would be 50% clinical and 50% research. That research really focuses on the manner of delivering health care and how that affects things like outcomes and value. So we believe we have something that's very comprehensive and somewhat unique and allows people kind of another opportunity to determine what it is that they want to be doing for the rest of their career and really find an effective way to learn how to do that. We have a very large catchment area from South Georgia west to really the Panhandle and some specialty areas, and down as far south as Daytona.
I get a very wide range of experiences with different diagnoses, age groups, ethnicity, race, sexuality, so it's been awesome in that regard.
We all, the psychologists, have a wide variety of interests and specialties, and so if the fellow has an interest in, say, sleep disorders or comprehensive behavioral intervention for tics or gender wellness, we can provide other opportunities for them to have supervised experience seeing patients. One of the benefits to us is being part of a very large children's health system with sites in Delaware, Orlando, and Jacksonville, and that's benefited our fellows as well. We now have a series of seminars that are done on Zoom meetings that involve fellows at all 3 sites, which has really allowed us to broaden our training programs because there can be psychologists at all of the sites that are involved in that as well, and that focuses on things like wellness and self-care, diversity and inclusion, preparing for the licensing exam. One of the innovations that we're really excited about in psychology is the growth of our telemedicine, telehealth program. When the pandemic started and the clinic had to shut down for a while, we continued to see our therapy patients pretty much seamlessly through the Nemours telehealth system, which is helpful for some patients just because of distance, but also because it's very desirable to teenagers to be able to just talk to you from their desk at home. We really try, because we do with our patients as well, to make sure that our fellows have a good work-life balance.
I was really pleasantly surprised with Jacksonville and all that it has to offer. As far as I went to a concert the other night, a Kane Brown concert, which was so fun. I've gone to the beach multiple times.
Another major focus of our psychologists is really to prepare our fellows to be able to function independently in whatever kind of practice they like. So we have fellows who are working in major medical systems, we have researchers, we have people who are doing policy making all over the country, really. We have a number of fellows who've liked it so much that they've applied for a job here and are now on our faculty. So I think that's a statement to the training they receive and the feeling that they have here at Nemours.
I feel like if there's any area that's missing, like on my CV or resume, I'm able to reach out to my supervisors and let them know they want to set me up for success in whatever it is that I want to do.
I have loved my job for the very many years that I've been a pediatric psychologist, but I really enjoy the teaching aspect of it too. So while I do continue to see patients, I really value the opportunity to be able to kind of help mold someone and determine their interests and develop their career path and make sure that we're sending out people who are really effective in the community that they choose to live in.